it is my pleasure and honor today to introduce our speaker for today. She's loaded with fun and information, knowledge, right, that we're going to have today. So our speaker today is Dr. Ayeni Omotayo. She is the head of the Department of Obstetrics and Gynecology at the Lagoons Hospitals here in Lagos. She has special interests in reproductive endocrinology and fetal maternal medicine. She earned her degree from the Obafemi Awolowo University, Ile-Ife, and undertook her residency training at the University of Ilorin Teaching Hospital. She has also done extensive research in pregnancy, outcomes, emergencies, and in retroviral positive women in selected areas in Nigeria. My pleasure to welcome Dr. Ayeni Omotayo. Dr. Ayeni Omotayo, over to you, ma'am. Thank you for joining. Yes.
Thank you very much. Thank you. Once again, my name is Dr. Ayeni. And today we will be discussing sex in pregnancy. Is it really safe? And I'll be discussing it under this hotline. I'll be introducing it. We'll be looking at it if sex is really, really safe in pregnancy. The pattern of libido. Libido is the desire for sex in pregnancy. Way to avoid sex in pregnancy. That's under the hotline. So can we go to the next slide, please? Then sex position in pregnancy. Are whole sex position safe in pregnancy? Then is there benefits of sex in pregnancy, or is not something that you should even need at all? Is oral or anal sex safe in pregnancy for people who practice it? Then you have delivered. After you have delivered, is sex safe? When do you start sex? After you've had either a vaginal delivery or a cesarean section, and will be concluded. So as a form of introduction, there are a lot of misconceptions and myths around having sex in pregnancy, especially in sub-Saharan Africa, which Nigeria is part of. This affects sexual relationships between couples during pregnancy. For men, sex is like food for them. And you know that a man is aggressive until he has sex. It's sex that calms them down, oftentimes. So sexual deprivation and menstruation with increased domestic violence. The man is just beating up the wife. Or emotional violence, emotional torture. He's not giving her attention, emotional deprivation, abuse, home conflict, always fighting. And this may even lead to broken homes because the man will be keeping mistresses outside to satisfy his sexual urges. But some people will say, oh, if I have sex in pregnancy, it can increase my risk of cesarean section. Some people will say, oh, if you don't have sex, it can increase your risk of cesarean section. Are these myths and misconceptions, are they correct? Is sex safe in pregnancy? To answer that question, sex is perfectly safe in pregnancy, in most pregnancies. So don't get me wrong, there's some condition that sex should be avoided in pregnancy, and we are going to get to that. But in normal pregnancy, your doctor has not told you that you have any problem whatsoever. Sex is perfectly safe in pregnancy. In fact, having penetrative sex will not harm or hurt your baby. And your baby will not even know what is going on. For people who have a lot of decorum, oh, I don't want to have sex because I don't want my baby to think I am meeting with the father. You know, the baby will not even know that anything is going on. And sperm too will not harm your baby. For people who use sex toys will not harm your baby because this goes into the vagina. So it doesn't harm the baby, it doesn't cause any miscarriage, it doesn't increase bleeding in a normal pregnancy. So let's look at sexual desire, sexual urge in pregnancy. why some people run away from sex and why some people desire sex more in pregnancy. In a lot of women, there can be increased libido in the late first trimester or towards the second trimester and early third trimester. Some even, it's only in pregnancy, some women will even achieve orgasms for the first time in their lives. You know, because in pregnancy, you have the hormones, progesterone, and all the other hormones working on the body. So the genitalia, that's the vagina, it has more folds that we call the rugae. It's supple, it's succulent. So and it is even engorged with blood vessels, and it is very sensitive. So a lot of women, they tend to achieve orgasms more in pregnancy and even enjoy sex more in pregnancy. But some women have reduced or no desire for sex at all, especially in the first trimester. And why? They are vomiting. They have morning sickness. They're not even able to eat. They know they are just experiencing pregnancy symptoms and it's disturbing them. I want them to be having sex. So some of them it gets better. But for a lot of women, like about 10 to 15% of them, about if you gather 100 women, about 10 of them or 15 of them, we experience this reduction or absence of desire for sex in pregnancy throughout pregnancy. In some women, the vagina is dry because the vagina, the cervix are sealed up, you know, things from going to the baby. So they just don't lubricate in pregnancy. For people who have had previous vaginal tear, who have had cuts in before, and they are battling gland, there's a gland that is in the vagina that also lubricates during sex. If it has been damaged or it has been cut off, such women may not even lubricate in subsequent pregnancy. However, men, they enjoy sex better in pregnancy. So don't think there's a problem with your husband that is not afraid of your big tummy, doesn't even know you are pregnant, and he wants to have sex with you. He may even have a higher desire for sex in pregnancy. Why? The shape of the woman changes. Our curves comes out, so it attracts the men. Then when they come inside, the vagina is very succulent, it's soft, it's supple, the folds are more, it grips their phallus more, so they tend to enjoy sex better in pregnancy, and that's why they desire it. So we have said sex is safe in pregnancy. When is sex not safe in pregnancy? Are there conditions that sex should be avoided in pregnancy? Yes. When there's bleeding in pregnancy. We have bleeding in the first trimester, we have bleeding in the second trimester, or in the third trimester. In the first trimester, that's pregnant miscarriage. There any bleeding after pregnancy is said not to be safe for sex in pregnancy, but then because there's increased risk of miscarriage, so your doctor may advise you to avoid sex in pregnancy. For people that are in the second or third trimester, your doctor may advise you to avoid sex in pregnancy if there is if the placenta is before the baby, that we call placenta previa. So the doctor may say avoid sex in pregnancy, and that one may continue to deliver. For the people who had it early, they may ask them to resume when the danger has passed. If you have cervical incompetence, cervical incompetence is the inability of the cervix to hold a pregnancy to full term. So the woman is having recurrent miscarriages. In fact, the doctor may need to put a stitch to keep the baby in place. In that kind of scenario, your doctor may advise you to avoid sex to increase your risk of having a preterm delivery. If you've had previous preterm delivery, or you are carrying twins which have risk of preterm delivery, your doctor may advise you to stay away from sex to allow that baby to come to full maturity, because we know prematurity has its own problems. If you have ruptured your membranes, the water that covers the baby has been released, you will need to avoid sex. Why? Because men, they don't want to watch their phallus before they come in. And coming in introduces infection. Then they come in, they come out, they come in, they come out. They bring death from outside to inside and can increase the risk of infection setting in for the mother. So we advise such women to avoid sex in pregnancy. So we look at sex positions in pregnancy. Are all sex positions safe in pregnancy? No. We don't even want the woman to lie flat on her back. You know why? Because there's a risk that we call supine hypotension syndrome. When you lie on your back, because you see the uterus is a small organ like the size of an egg before you got pregnant. When you now get pregnant, it enlarges to 1,000 times and displaces the structures that are supposed to be in the abdomen, mainly the major blood supply to the body. That's the vena cava and the aorta, and lies on it directly and causes reduction in blood flow to the baby and to you yourself. So you may feel dizzy, it may cause problem for the baby. So that's why we say, oh, lie on your left side. So we don't want you to lie on your back. So missionary position is a no-no in pregnancy. So what are the positions for sex that you may consider in pregnancy? The woman may bend in front. You can lie on all your fours, or you lie on the table, and the man comes from behind. You need to support yourself very well, because in pregnancy, you may feel dizzy. The center of gravity is altered in pregnancy. So you may need to hold a table or hold a chair, and the man comes in from behind gently. Or you lie on all your four. You may also be the one in charge. You may come on top. But this position may not be that comfortable, especially in the third trimester, because the head of the baby is coming down. So you may be complaining of pain during sex in pregnancy. There's a method that they call spooning. The two partners, they lie sideways. The woman lies with a pregnancy pillow supporting her. Then the man comes behind. They both lie on their side, and he comes from behind. Or you may sit side by side. I've said it before that we want the missionary position, or even lying face down. You lie with your tummy face down. It's a no in pregnancy. We do not encourage it at all. It can lead to problems. So let's go to benefits of sex in pregnancy. Is sex even necessary in pregnancy? Can you do without it? If your husband is not around, that you're not having sex, it's not a problem. It doesn't increase the risk of cesarean section for you, for women who do not live with their husband. So it's not that it is absolutely necessary for you to have a safe pregnancy outcome. No. But when your husband is with you and you have a normal pregnancy, you don't have any risk that will necessitate you from avoiding sex in pregnancy. It has a lot of benefits. This improves bonding between the couple. Instead of the man being deprived of sex, looking for sex elsewhere, keeping mistressing, it helps to bond the couple to prepare for a good pregnancy outcome and to welcome a happy baby, a healthy baby into a happy home. It improves sleep because the woman sleeps, the couple sleeps after sex. And in pregnancy, now women complain about poor sleep in pregnancy. So when you have sex, it relaxes you, it increases some hormone, the release of some chemicals in your body, and helps you to sleep well in the night. And also it improves your mood. It improves your husband's mood. Everybody is happy in pregnancy. Then it may help in labor. You see, studies have shown that the sperm contains some chemicals which can help in the ripening of the cervix, which is the mouth of the womb. It can make it, better for labor. So that is what studies have shown. Then sex is a form of exercise. It helps women to keep fit, to tone their hip muscles, tone their abdominal muscles. So it will be very good. Those are the benefits in pregnancy. Let's look at oral and anal sex in pregnancy for people who practice it, or the use of sex toys in pregnancy. Oral and anal sex in pregnancy is perfectly safe in a normal pregnancy. It is safe. However, we want you to avoid oral sex in pregnancy. They call it fellatio, right? Some people even practice it, you know. The husband licks the wife in pregnancy and even helps the woman to achieve pregnancy. But if the man has respiratory tract infection or the woman has visible vaginal lesions, please avoid it because there can be transfer of these infections to the woman. Especially we talk of infections like herpes infection. So the man can now have infection from the woman if there's an open sore, or the man gives infection to the woman. For the anal sex, if there's hemorrhoids, and hemorrhoids is common in pregnancy because of the increased abdominal pressure. You know, the blood vessels that are in the anus, they come out. That's what we call hemorrhoids, and that's why they bleed. You know, please avoid anal sex because it can increase bleeding and pain in pregnancy. So I have been pregnant. I have delivered. I delivered via a cesarean section or a vaginal delivery. When can I resume sex? Sex can be safely resumed 6 to 8 weeks after both deliveries, either a cesarean section or a vaginal delivery. For cesarean section, once the lochia is the blood that comes after the woman has delivered. In fact, the woman is good to go. Why? Because there is no cut in a vagina. A vagina was not touched. So the vagina is intact. So the man that can quickly come in, safely bond with his wife, prevent domestic conflict, prevent, you know, disharmony in the marriage or broken homes after 6 to 8 weeks of pregnancy, because that is when the lochia dries up. For vaginal delivery, even if you have a tear, well repaired, within 6 to 8 weeks, it should heal and the man can come in. And trust me, oh, you having pain, the penis is still the best dilator for the vagina after a delivery. But we want you to avoid having sex if there's still a wound in your vagina 6 to 8 weeks after delivery. So in conclusion, penetrative sex, oral sex, anal sex, or using sex toys in pregnancy is perfectly safe for most women. Don't forget the women that we ask to avoid sex in pregnancy. The benefits for women to have sex in pregnancy that you don't have risk factors to avoid it goes beyond the medical aspect. Oh, because I don't want to have a vaginal delivery, I don't want to have a cesarean section, I don't want to end up with a cesarean section. Or no, it involves your social and emotional well-being to keep your home happy and safe and protected from intruders. Sex in pregnancy is not harmful to the baby. The baby will not even know anything is going on and will help you to welcome your baby to a happy and united home. So thank you, everybody. We'll be welcoming questions at this stage.
Thank you, Dr. Ayeni. You did an awesome job. This is really interesting. Yesterday, when we demoed the call, I mean, we didn't know you were just giving us a preview, as in you went in depth on this one. Thank you so much. So please send in your questions on the chat. And if you wish to speak, you could please use the raise hand function and we would unmute you to speak. Dr. Imosemi, thank you so much for joining on the call. We recognize your presence and we're so glad that you're always with us. So we might also direct some questions to your end as well. So Dr. Ayeni, I think we could start by treating some of the questions that we have from our women and then see that I'm sure people will put in more questions in the chat as we go on. And I can see from Oniye Okafor, she's saying, thank you, Dr. Ayeni, for this explicit presentation. Thank you so much. So Dr. Ayeni, one of the questions asked by our women is on dyspareunia, right? That is pain during sex in pregnancy. So she says that she's 35 weeks pregnant and that she has pain while having sex with her husband. So what do you say to pain during sex in pregnancy and then afterwards as well? Yes. And what advice would you have for this woman? Yes.
Okay, thank you very much. In pregnancy, 35 weeks. Don't forget that during the lecture, we talked about vaginal dryness experienced by some women in pregnancy, especially the ones that don't have any libido. They don't have interest in the sex. So then don't forget the way the men just jump upon the women. They without enough foreplay to allow them to even lubricate. And you even need to do an extra work in pregnancy to get that woman to lubricate at 35 weeks. So vaginal dryness may contribute to this. Another one that can contribute to this is the head of the baby coming down. So the head of the baby has descended into the pelvis, and the man can easily, as he's trusting, trust towards where the head of the baby is sometimes, and that one can give the woman pain in pregnancy. So these are the things that may contribute to having dyspareunia or pain during sex in pregnancy. We do not advise the use of lubricants in pregnancy. Really, the reason is because it can introduce infections. Women do use it, but you need to a lot of times it may be it's a foreign substance you are putting, especially for women who have risk of preterm contraction. And if these bacteria enter, they are the ones that will cause problems. So we advise them to do a lot of foreplay, allow the man to calm the woman down, and gradually enter from the back. And if it is too painful for the woman, please, we advise to stop. You are 35, you will soon deliver, and the man will have you fully back.
Thank you, Dr. Ayeni. Thank you so much. Yes.
I have a question, Dr. Aima, if you don't mind.
Sorry? Okay. Yes, please go ahead, Dr. Kendra.
Thank you very much, Dr. Ayeni, for that really great presentation, and to Dr. Emuseni for joining us. So I'm very happy that we have the two sides of the coin. We have a male obstetrician and we have a female obstetrician. So my question is actually to the male obstetrician. Dr. Emuseni, what advice would you have for husbands? Like, the wife is cranky, she's pregnant. I do not just want to be touched. My breast is sensitive. I'm not in the mood. I'm just hormonal and cranky. What advice do you have to the husband looking to catch some action from this wife that is not just in the mood? I think Dr. Emuseni might be muted.
Yes. So, Dr. Emuseni, please, can you unmute? Okay, so I think he might be struggling. So please, let's see if we can help him.
The question.
Dr. Ayeni, yes, please, can you take that on? And he can then, yes.
I'm on. Okay. Yeah, I think he's on. He's about to speak.
Okay. Awesome.
I'm on.
Okay.
Yes.
Did you get the question, Dr. Emuseni?
No, I didn't get it.
Okay. Dr. Kendra, do you want to ask it again?
Dr. Emuseni, so I was saying that what advice do you have for husbands looking to get some action when the wife is just pregnant, hormonal, cranky, not in the mood? She's sensitive to touch, her breast is sensitive, she's just not having any of it. What advice do you have for husbands looking to support their wives and get them to that point where they're willing to?
Okay, all right. So 2 things. So thank you very much for the presentation. And I've done that. And thanks for the topic. It's relevant. And incidentally, I have a couple, in front of me, having some sessions. So they've had to latch onto it. So quickly, I think what is very important is, for couples, to benefit from, a proper antenatal care. And that includes, providing information. In fact, you anticipatorily, touch on, I call them key areas, that are very, very important and that continue to elicit questions and all of that. And one of them is sex, So in other words, when I'm having a session with, my antenatal patient, the husband is usually there. We call it couple session and all that. And you talk about a lot of things, food, diet, what pregnancy is all about, and all of, and then more importantly, sex. Again, to answer your question directly, and I will now complete by saying that you have a number of women, I hope it was mentioned, who have increased appetite for sex. If anything, I've had men say, I don't know what has happened, though, my woman wants to kill me, in quotes, and all of that. So let me just quickly say that. So to answer your question is to let the man know that the baby being carried on behalf of both of them elicits, hormonal changes that in some women make them very cranky, okay? And that the man must understand that in a certain percentage of women, especially during, from the second trimester, where the amount of progesterone goes up and where other changes take place to begin to blunt appetites for sex in certain women, the man must understand that the woman needs to be supported. It does not mean that the love for him or for some of the actions in quote that have copiously taken place pre-pregnancy, it doesn't mean that the love has waned, but that is just a mood and all that is a response to hormonal changes that inevitably happen in pregnancy and in a number of women could cause this. So once the man understands that is beyond this woman, who is carrying out an assignment on behalf of both of them, at least that info is very good. And the woman can do a lot of things to ensure that, oh, darling, you are good, a lot of talk, to pacify the man, make him feel well, and all of that until perhaps the mood change. So my summary is that one, let the man know that what is happening or what the woman is feeling is a recognized phenomenon. Is hormonal driven, a number of times mechanical, especially when the tummy. Then number two, you must again understand why the woman is cranky. Is it just hormonal, or is it that the tummy is big and so she thinks that it's the regular missionary position that will be taken? So uncover why the woman does not want to have sex. If it's hormonal driven, there's nothing you can do other than to get the man to understand. And then get the woman to, through some other means, pacify the man, encourage him, and then, we'll just take it from there. But I think it's a very interesting topic. Let's see what our female gynecologist has to say. Thank you very much.
Thank you, Dr. Emerson.
Thank you, Dr. Emerson. Thank you.
Like you said, it is actually counseling. Or making the man to understand what the woman is going through, as well as making the woman to understand the needs of the man. You have to do a balanced counseling for the two of them. Most of the time, the symptoms the woman is experiencing, you just have to attend to them and make it better. Once she is happy and the symptoms are better, especially in the first trimester, this woman is throwing up. She's nauseated. She's just weak. She feels eternally sick. We need to make the man to understand that it's even the father's component in the baby that is making this baby to fight the woman, to drop down all her defenses, to be able to allow the baby to grow. Once you handle the symptoms, you counsel them very well, you have a happy couple. You'll be able to, copulate with each other in pregnancy.
Thank you, Dr. Ayeni. Thank you. So we need to cooperate with our wives. We need to work together at achieving an interesting sexual life while she's pregnant. And patience is needed. Thank you so much. So Dr. Ayeni, there's also a question here from Eunice, who is on the call. She says, I'm 6 months pregnant and I resumed sex after 4 months because of my health. I enjoy sex well during this period and I lubricate well, but each time I achieve an orgasm, I end up having lower abdominal pain and I'm almost useless all through that day due to weakness. What could be the reason for this? And then what do I do? Yes.
Now, the orgasm, the orgasm, it leads to contraction.
Okay, Dr. Ayeni, is this Dr. Ayeni's network or mine? Okay, better now. I think you're back. But we cannot hear you, Dr. Ayeni. Not, just in case. Okay. I cannot hear Dr. Ayeni. Dr. Ayeni, we can't hear you. Dr. Musemi, while she sorts out, okay. While she sorts it out, do you want to take on the, okay, I think you're back now. Hello, can you hear us, Dr. Ayeni?
Yes, I can hear you. Sorry. That was from the office. So the thing about this is that
okay.
When you have orgasm, the entire reproductive tract contracts. And don't forget that your uterus is having extra blood supply, and the innervation is very sensitive during pregnancy, and that is why you have the pain. But that doesn't mean that there's a problem. Then also the sperm that is deposited also causes some kind of contractions for you, but that doesn't mean it's going to lead to any harm. So what you need to do is to rest the way that you have been resting. Grade the pain in a score of 1 to 10. If you think the score is up to like 6, you can take paracetamol. Paracetamol is 100% safe in pregnancy. That is if you have rested and it's still not working. If you think it is more than that, you may need to go to the hospital to check if everything is fine with you.
Hello, Dr. Ayeni?
Yes, ma'am.
We cannot hear you. I think we lost you for, okay. We lost you for a bit there, so yes.
Oh, okay. So what I said was that if the pain is because of the increased blood supply and sensitivity of the uterus in pregnancy, also the sperm too contains chemicals that makes your reproductive tract to contract in pregnancy. So when you experience that, just lie down and relax. If you think the pain is still significant, take paracetamol. Paracetamol is 100% safe in pregnancy. Then grade the pain in a score of 1 to 10 to know the severity. If the pain the score is more than 6 and you are taking paracetamol and you are not relieved, please visit the hospital so they can ensure that everything is fine. But the pain that you experience that stays for a short while is perfectly normal in pregnancy.
Thank you so much, Dr. Ayeni. Thank you. Yes, I'm sure the question is well answered for you, Eunice, right? So we have another question. A mom on the call says, an expectant mother says, I'm expecting 2, and then I'm 26 weeks pregnant. I enjoy having sex. I want to ask if it's safe for me to continue having sex. So she's pregnant with twins, right? And she's 26 weeks gone. So she wants to know if it's considered safe for her to have sex, being that she has 2 twins. Yes.
I am aware that twin gestation is a risk factor for preterm delivery, but not in all twins. It's not in all of them that you have. So the risk of the woman having a preterm delivery in twins is unknown, and there is currently no management for it. It's just observation, and when they come, you take care of them. So we cannot say, oh, because you're having twins, you're going to have preterm delivery. No. So if you're enjoying sex, you're up to 26 weeks, and there's no problem. Please carry on with your sex. so far you can tolerate it, it's perfectly safe for you.
Thank you, Dr. Ayeni. Thank you. And then we have a question from a mom, right? She is 11 weeks pregnant, and she says that she had sex with her husband, and then she saw spots of blood, just a few. She says just about a teaspoon or a tablespoonful. And then she wants to know what to do about that, and if it's something that she should be concerned about, as it was just a single episode.
Okay. Now, after pregnancy, any bleeding in pregnancy must be investigated. It is not all bleeding that are actually threatening miscarriage in pregnancy or will lead to a miscarriage in pregnancy. But you are not supposed to have any bleeding at all after you have missed your period. So any bleeding must be investigated. It is normal that you just have some cervical erosion. That means the cervix is faced outwards instead of inward. So which may be normal, but you need to still see your doctor for them to do a scan, check you up, and be sure everything is perfect. Because after having sex in pregnancy, you are not supposed to sport. But some people do sport if they have erosion or they have a polyp. But let's be sure that that is what is the cause, and put your mind at rest instead of thinking it's something more sinister. So you need to still see your doctor for proper evaluation so your mind can be perfectly at rest.
Thank you, Dr. Ayeni. So to that mom, she needs to see her doctor and be reassured. So yes, there's another question we have. It says, is it true that as you get close to delivery, you should not have sex as you approach your term, that's close to 37 weeks? Yes. Yes.
Oh, sex, we actually advocate sex when you are close to your delivery. Like I've said before, sperm contains some chemicals that studies have shown that they may help to make the cervix soft and open up, reducing prolonged pregnancy. That's pregnancy that you pass your date. So we encourage it. So rather than say, no, don't have sex when you are close to that, no, we even encourage it. Unless you have seen water, you have ruptured membranes. When the membranes have been ruptured and we want to buy more time for the baby, we say do not have sex. For that, we don't even wait a long time. Once we think the baby is viable, from like 34 weeks, baby is viable, you can deliver. But everything is going on fine. There is no problem. The placenta is not before the baby. It's not that, oh, you have some incompetence or you have been told to avoid sex. Please, sex close to term or at term, even before you deliver, is perfectly safe.
Dr. Ayeni. So yes, to that mom, having sex, it even helps you, right? Helps your cervix to dilate and all of that. Thank you so much, Dr. Ayeni. So I will ask this question to you, Dr. Ayeni, though we are still going to ask that you please recap right after the session so that we have a take home in general. But there is a question that says, is there a best position during pregnancy? Out of all these things you've told us, these positions you've taught us about today, right? Is there a best one that you would say is best during pregnancy? Yes.
All the positions that we've mentioned today, they're actually good positions. It has to do with what works for you. But the spooning method has a lot of acceptability because the woman lies on her left side. She supports herself with the pregnancy pillow, so she's not distressed. The man comes in from the back, so she's relaxed, and the pain, the discomfort is better than before. Instead of sitting on top and the woman, in third trimester, you're not even be able to do that, or lie on your paws, or lie on the table. So the spooning method has been found to be better than the rest. But all methods are actually good. This is the one that works for you that you should go for.
Thank you, Dr. Ayeni. So we have an interesting question and comment from Mr. Benjamin on the call. He says, I listened to the response to the question about advice for men whose wives are not in the mood for having sex during pregnancy. Says that I agree that counseling will work for a while. However, how long will counseling work as pregnancy is 9 months long? So that's really a rhetoric question, right?
Yes, I know. Dr. Imosemi has actually answered this question before.
Yes.
He said
yes.
that the woman is the one that will have to work on the man and palliate him, you know. A part of the counseling will be explaining to them the need for them to have a baby. The man will always choose his baby anyway. It's either the baby or we don't have the baby. So it's a choice we need to make. It's a difficult decision. But like Dr. Imosemi said, the wife needs to work on pleasing the husband, especially at this. It may be difficult because she's also cranky. She's not even finding it funny, you know. But like Dr. Kenda just posted, the Lord is your strength.
Okay. All right. Okay, so this is from a mom, says that what can some say she's a mom, right? And she's had a baby. And that what can she do? What can someone do when there is little or no urge for sex after childbirth? I think both yourself and Dr. Imosemi, it would be nice to have your opinions on this particular one. Yes, so you could go first, Dr. Ayeni, please. Yes, please.
Okay. As for a woman who has low libido after sex, is normal. After delivery is normal. Because delivery, the stress of raising a child, waking up in the night, taking care of the needs of the child, leads to exhaustion for the woman. And she doesn't even have appetite. And she's trying to recover herself from a very long period, 9 months of carrying pregnancy. My advice for her is to calm down. Look inward. Look at her marriage. Look at the need of the man. Sex is like food for a man. It's a basic need for them. And look at how he has supported and how she needs to sustain her home. That's also part of counseling. Also, she needs to calm herself down, watch videos that can stimulate her, have discussions with her husband for her to be able to have this libido back. Then your husband, she also needs to look at her schedule. Is this a baby that is stressing her out? She may need to get up. She may need to look at the things that are causing the lack of libido. If it is pain from the vaginal tear that she has, the doctor may need to have a second look. But I've told you that it is actually the penis that dilates back perfectly to the way it was before. But seeing the doctor too, we help them to know exactly what to do about going about it. And if the wound delays in healing, the doctor needs to also help them. So I don't know if Dr. Imosemi has something to add today.
Yes, please, Dr. Imosemi. Would you like to add something to this? Yes. Thank you, Dr. Ayeni.
Thank you, Dr. Ayeni. I think Dr. Ayeni has expansively, spoken on the issue. The reality is, once a baby is born, come on, we expect the man and the woman, the couple, to celebrate the arrival of the baby. And thank God there are a number of naturally occurring events, around that time that even in both people, the couple reduced the appetite. Number one, the woman is battling with breastfeeding, sleepless nights, the first 1-2 weeks, the woman is still having what we call low care. Low care is the blood, that comes after, baby has been born. And the first couple of days is red, it changes to yellow, it changes to white, and all of that. And like has been said, most women, again, because of changes that have happened around the perineum, a number of them would have had episiotomy, that is cut and all of that. And then the stress, I'm sure our men are sympathetic. You understand what I'm saying? It's unfair to say that the Lord is our strength, as though men are sympathetic, So, and our women really accept their compelling reasons for them not want to. They usually, want to defer to the men, or rather enjoy or savor, what the man wants. So it's the one. So by the time they are not forthcoming and all that, it's for them to understand why. This man has just delivered. She's having a lot, taking care of the baby and all of that. The first 1, 2, 3 weeks, the man is not in a position. She's bleeding. I don't tell us that the man will still want to, in spite of that, do what he should not do. You understand? And that blood will change from red to yellow to white. And once the woman begins to get stronger, so the man can do a lot to help the woman recover faster, get somebody to help, and thank God our mother-in-laws are there, we get helpers, and all of that. But the woman has to breastfeed. A lot of things that the woman has to do on behalf of the man on their own, engage the woman. So I'm sure the man understands. And luckily, by the time there is stability, the woman is more stronger. That's when the man's appetite, or when the couple's appetite, let me not say the man, come back. And usually nobody who needs to talk to the couple. They will know that they are both ready for it, and they will consummate whatever they need to. Thank you.
Thank you, Dr. Emusimi. Thank you, Dr. Emusimi. Please stay on. I have a question for you from Benjamin as well. He says, so what long-term advice do you have for husbands who for medical reasons can't make love to their wives during pregnancy, aside from the usual, the Lord is your strength response? So, yes.
Okay, fine. Again, in trying to understand the question, I think it's the other way around. If the man, for example, was in a position to make the woman get pregnant, I'm just trying to look at reasons why in pregnancy you may not want the man to continue to, you understand? Yes, maybe in some conditions, maybe the ritual status of the man, for example, may call for a need to be cautious and all that. The way out in dealing with that is to say, okay, you can use condoms and all that. Or where the man has been on medication. I'm talking of a ritual status man. I'm just trying to look at the few instances. You don't want the man having, put the woman in the, engendered pregnancy. You don't want him, to continue to have sex, even when both of them desire. I think it's the reverse. In other words, you have a woman who has a history of, recurrent pregnancy losses, especially in the first trimester, a woman who has cervical incompetence, a woman who has saprophagus, or a woman who is very ill in pregnancy. So except the man has some other medical illness incapacitating him, I'm just struggling to find out to, look at the very few instances where a man gets a woman pregnant, and then the woman now gets pregnant, the man has a reason, on the basis of ill health or his incapacity not to want to. So I want the man to understand where we're coming from. Most times, it's the woman, either because of hormonal changes in the first 3 months, where the woman is vomiting and all of that, or the woman is bleeding, or the woman has had recurrent pregnancy losses, or the woman has had a sac life. Even when the woman has had a sac life, when the sac life is properly done, and you give, a period for that thing to heal, a number of times it's not absolutely contraindicated that they should have sex. So to answer that question, I want to see it properly contextualized. Most times, the woman who is the baby that we have that she has, like has been said, sex, the man releases semen from the glandings, the glandings can. The woman who already has an inherent trait, by the time you do that, you add to it. So we realize this is very rare to have a man, who represents the man to have pregnancy, except if other things cropped up in that index pregnancy. the man has an injury, spinal injury, and he can't do that. So I think we should individualize it or contextualize it. But the reverse is more common. The woman has fibroid. The woman has situations that make her prone to having pregnancy loss. Because not mature, you don't happen so that you do not have a frequent delivery. Okay, so of course, that's a long job for both partners. The man will understand why, instead of having a healthy baby at the right time, he should temporarily abstain. The woman has a lot of, like I said, to pacify and provide some other alternative means. Okay, so I think so the thing is to understand the context that usually is the woman, that because of the baby that she's carrying and because of the fact that because of the
We can hear Dr. Moseni so well, but I think we got the crux of his answer. Thank you, Dr. Moseni. Do we have Dr. Ayeni still on the call?
Yes,
okay, Dr. Kendra, did you say you didn't hear me well?
No, we
Yes.
lost you for a minute, but we got what you said. We lost you for a few seconds, but we heard what you said.
Okay.
Thank you very much. Dr. Ima, over to you. Okay, just asking the next question that we have. I'm going to take this to Dr. Ayeni. There's a question from one of our healthcare workers on the call. She says a client visited the facility and complained bitterly that she had been married over 20 years. She inserted implanol and has not had any libido since putting this implanol in. What advice do you have for this patient?
Okay. So that's contraception is different from the topic we are addressing, but I will answer the question. Implanol contains it contains ethylene which is a form of progestogen. And when you use those ones, you are putting the woman in pseudo pregnancy condition. So like a forced pregnancy condition. So there can be reduced libido with implanol. It's a very rare side effect, but it is a known side effect of implanol. So she may need to go for another alternative of family planning. If she prefers the one that is still progesterone, you may consider the one that does not have a systemic effect like the progesterone. You can consider Mirena, which is progesterone impregnated IUD, or you may decide to use the other IUD for her, or other forms of hormonal contraception, or other contraception. If the pills is also associated with a reduced libido. So you may need to really push the options open to her and treat her like a pregnant woman that we have discussed about. Because implanol or not plant puts them in pseudo pregnancy state.
That's a very informative answer. Thank you so much, Dr. Ayeni. So we have another mom asking, can a tear or episiotomy cause reduced vaginal lubrication later on?
Yes, I've mentioned it before. If the Bartholin gland was damaged, it can reduce it. It can reduce it. Another thing is that if the pain, if the platform that the woman during sex, and you know that when you have pain, the lubrication stops, or the woman is fine. So those are the things that can cause reduction in lubrication after the delivery. So you may need to visit your gynecologist to know exactly what it is and help you with it.
Okay, thank you very much. And just to clarify, I know we've asked this question in different ways, but just to clarify, if a pregnant woman has a cervical sacrilege inserted, done, right? Does that mean
Yeah.
no sex for the whole 9 months? Or is there a
No.
gestation age that sex now becomes safe?
Yeah, like Dr. Omofoluwake already said, for people who put on who have cervical sacrilege, it's not throughout the 9 months. What I do for my patients is that once the patient is 28 weeks, that's the age of viability in Nigeria. And I'm sure the woman can carry the pregnancy to term, especially for the ones that have had very bad outcome. They've had previous recurrent loss of pregnancy, previous failed sacrileges. Those are the ones I get to see. I avoid sex until they reach 28 weeks to allow, at least I'm in the age of viability. Even if the baby comes out, I know I will have the baby. So that's what I do. For the people that is just the first time I'm putting a sacrilege for them, I leave them from like 20, 22 weeks to have sex once in a while, then full sex from 28 weeks. It's just to ensure that I have the baby in my hand. So it's not throughout the 9 months that we do that.
Hope the men on the call are hearing well. Okay, so we have another question. After ICS, when can one resume sex?
Okay, so that section I've mentioned before, the vagina was not affected. The baby did not pass through the vagina. The baby was brought out from the abdominal incision and cut. So the vagina is intact. Once the lochia stops, Dr. Omotayo mentioned that the lochia initially will be red, then yellowish, then whitish. It takes a total of 6 to 8 weeks. That's why we put resumption of sex 6 to 8 weeks there. Once it has dried up, it is safe to resume sex with your husband.
Okay, thank you very much.
Thank you,
Over
Dr.
to you, Dr. Ayeni.
Yeah, thank you, Dr. Ayeni. Hope you can hear me. Okay.
Yes, I can.
Okay, so we had a question from a pregnant woman, and she says, if a pregnant woman is having contractions, can she still have sex? So yes, just I guess that's really yes. So please just take on that, and it will help to let her know why not. Yes.
The contractions will be: is it a preterm contraction or is it labor? Preterm contractions that will lead to cervical changes. That means your cervix is open, the cervix is shortened, and you're having at least one palpable contractions in 10 minutes or in 8 minutes, and you are far from 37 completed weeks. That's the time labor. We will advise you to avoid sex during that time. Or you are in labor, you are seeing water, and you are contracting. It's not safe to have sex. You can increase the risk of your baby having mental sepsis. But you are calm. You are just waiting for your baby to come. You're just having contractions that is Bassin Hicks. That's the first contractions, or the one that will accumulate in labor. You have not passed show. The one that is intact. Please, sex is safe. Continue to enjoy yourself with your husband.
Thank you, Dr. I hope that answers that question. Thank you, Dr. Ayeni.